Almost every Oklahoma business that does reopen is quickly discovering that business as usual no longer exists, at least temporarily. This week I visited a dental office to see how that industry is coping with Phase 2 guidelines. Dr. Terry Rigdon has practiced dentistry for 42 years. He thought he'd seen it all until COVID-19 restrictions shut down his practice on March 18th.
You know, I started this business, we didn't wear gloves, we didn't wear masks. And then things changed for the good. And then when the AIDS epidemic came around, we increased our protection and our procedures radically. Now we're doing it again.
During the 44 days his office was closed, Dr. Rigdon studied online guidance and best practices from the CDC, FDA, and American Dental Association, and occasionally did see patients.
We were allowed to see emergency patients, and we did see some emergency patients. And our goal during those appointments was to get that patient to a point where they were out of pain and they were able to make it through till we was able to see them to complete their treatment.
Hi Denise, how are you?
Good.
I'm going to take your temperature real quick.
Thank you.
When a patient comes to our office, we ask that they stop in the parking lot and call us. We don't want patients passing each other and meeting each other in our hallways here.
After answering a series of questions, patients are taken to their treatment rooms, given a disposable gown to wear, and asked to rinse with hydrogen peroxide for a full minute.
So the purpose of that is to reduce or eliminate the amount of coronavirus in the person's mouth. So if it's flying around in this aerosol, we're less likely to have a problem.
And while that's happening, Dr. Rigdon is gearing up too.
So the first thing that we're going to do is we're going to put on 2 masks. We use the N95 mask, which are the super protective masks that are recommended.
That's followed by a washable gown, a plastic face shield, and gloves. Now the work can begin. And getting back to work is imperative because, bottom line, Dr. Rigdon is a small business owner.
6 weeks, I tried to pay my staff. We tried. Wasn't real successful at it because you don't have any income coming in.
He says the federal government's payroll protection plan did help.
But it's hard when you're not working. You know, it's got a heck of an impact. Financially and mentally.
Rigdon estimates the additional cost for PPE and sanitation will run a small office like his about $30,000 a year, and a large office as much as $100,000 in added expenses.
That's a lot. Now, how do you recoup that? That's all questions that are being asked a lot right now, and I don't think that we have any real answers yet. Boy, things sure have changed over the years, though, haven't they?
Yes, they really have.
Will they ever change back? Dr. Rigdon doesn't think so, and that's okay.
Maybe someday we won't be using the isolation gowns all the time. Who knows? It really doesn't matter. I mean, it doesn't bother me. I think we're pretty well used to it in 2 weeks, and we're ready to go.